If you are over 60, morning stiffness and joint pain may be more dangerous than they look.
Let me tell you about Diane. Diane noticed her physical stiffness was becoming more apparent over time. Her movement felt more restricted. Her hands felt stiffer. And some mornings, even buttons were a fight.
You see, but as a doctor, I have seen this many times. What people call arthritis getting worse is often arthritis plus a bad daily routine. Stay with me. Because one of these mistakes is so common. People repeat it every day and then wonder why the pain keeps growing.
Mistake number 1, resting too much.
This one sounds reasonable. If joints hurt, people want to protect them.
But too much sitting often makes joints stiffer, muscles weaker, and movement harder.
That creates more pain, not less. Rest can help during a flare. Of her. But living in the chair is how many older adults quietly lose function.
Mistake number 2. Skipping gentle movement in the morning.
After 60, joints often need a little motion before they feel safe again.
Not punishment, motion.
A few minutes of gentle movement can help improve flexibility.
And wake up the muscles that support them.
People skip this because it looks too simple. That is foolish. Mistake number 3, doing too much on your good days.
This is one of the biggest traps. You feel decent for a few hours. So you try to win back at a whole week.
Then the joint pays for it. The next day is worse. And the cycle starts again.
When managing daily tasks, pacing is essential. A good day is not permission to act like your joints are 30 years younger.
Mistake number 4, ignoring muscle strength.
A lot of older adults think arthritis is only about the joint. It is not.
Weak muscles around the knees, hips, and hands often leave the joint with less support.
That means more strain, more instability, and often more pain.
You do not need heavy gym training. But after 60, strength matters. A lot.
Mistake number 5, wearing the wrong shoes.
People underestimate this one. Bad shoes can make painful joints work even harder.
If the foot is unstable, the ankle works harder, then the knee, then the hip. The whole chain feels it.
Supportive shoes will not cure arthritis, but weak footwear can absolutely make it worse.
Let me say this clearly. A lot of people are not only suffering from arthritis, they are suffering from arthritis plus habits that keep feeding it. Then they say, my body is falling apart. No, sometimes your routine is the thing falling apart.
Mistake number 6. Eating in a way that drives weight gain and inflammation.
Additional physical load can increase the pressure on joints during movement, especially in the lower body.
And many ultra-processed foods make it easier to overeat and feel worse overall.
You do not need perfection. You need fewer stupid patterns.
When people eat more real food and less junk dressed up as comfort, their joints often like them better.
Not magically, but noticeably.
Mistake number 7. Ignoring swelling, heat, or sudden changes. This is the dangerous mistake, because not every painful joint should be handled the same way.
If a joint suddenly becomes much more swollen, hot, red, or hard to move,
That needs attention.
Arthritis pain can flare, yes, but sudden dramatic change should not be treated casually.
So what are some positive steps to consider?
move gently every day. Warm up stiff joints in the morning.
Pace yourself on better days.
Build some strength 2 or 3 times a week. Wear better shoes.
Watch body weight without starving yourself.
And most important, respect the pattern. Pattern. If your pain is changing, your function is dropping, or swelling is getting worse, do not keep guessing. Never stop prescribed medication on your own. And never replace real medical care with internet nonsense. That is how weak people stay stuck.
Now let me give you the red flag warning.
Please seek prompt medical care if a joint becomes suddenly red, hot, very swollen, or much more painful than usual. Especially if you also have fever or cannot bear weight.
and get urgent help right away if leg swelling is one-sided. If pain comes with chest pain or shortness of breath, or if weakness or numbness appears suddenly, do not lazily call all of that arthritis. Arthritis.
When Diane changed her routine, the pain did not vanish overnight, but the stiffness eased.
Her confidence improved, and her days stopped feeling like a battle from the moment she stood up.
She did not need false hope. She needed better habits.
If you are over 60, arthritis is hard enough already. Do not make it worse with routines that steal strength, increase stiffness, and punish your joints every day.
Tell me in the comments, which arthritis mistake do you think people make most often after 60?
And if you want clear, practical senior health advice without the nonsense, subscribe to Oakwell.
Because after 60, the mistake you repeat daily can hurt more than the diagnosis itself.